jump in and then we'll address the poll at the end. But good morning, good afternoon, and good evening to everyone, depending on wherever you are at in the world right now. Today, my colleague Missy and I are going to be bringing you our presentation called One Size Does Not Fit All, Adapting UX Needs Adapting UX Needs of Aging and Chronic Condition Patients. So Missy and I have over a decade's worth of UX healthcare experience across patients, providers, and payers, along with deep personal connections to chronic illness and aging. So why are we focusing on chronic illness today? Because it's one of America's greatest healthcare challenges, and with thoughtful UX design, we have the power to make a meaningful impact and improve the lives of millions of people living with these conditions. Our insights today will shed light on why the aging population plays a critical role in this conversation. You'll meet Sheila and learn about her journey with chronic conditions and also gain a deeper understanding of the caregiver experience. You'll also walk away with practical and inclusive approaches to research and design within this space. So why the focus on aging patients when talking about chronic illness? Older adults are disproportionately affected by chronic conditions. 85% of those 65 and older and 90% of those over the age of 85 live with at least one chronic condition. And over half of these people face two or more. So this shows that there is an urgent need for intentional and inclusive design solutions within healthcare. This slide here shows that chronic conditions become increasingly common with age, rising from 78% with adults between 65 to 74 years old, and 90% in those who are 85 and older. It also highlights just how important it is to consider seniors when designing for chronic illness. So this matters because 6 in 10 Americans currently live with a chronic disease, and their care needs are very different from acute care. Designing for chronic care means that you need to understand the long-term day-to-day experiences that these patients have. And acute care does not equal chronic care, right? So acute care is focused on like urgent, short-term treatments. So think about like triage and discharge. And chronic care requires ongoing support, education, and long-term planning. Designing for chronic care means thinking beyond the quick fix and thinking about creating a long-term patient engagement. Aging patients often need support beyond what hospital-based acute care can provide them with. Managing multiple chronic illnesses requires UX that extends into their daily lives and also into any non-clinical settings that they may be in. So patients with chronic conditions have really unique needs that tend to fluctuate over time and require continuous engagement. These conditions often affect their emotional, physical, and cognitive well-being. 80% of people with disabilities usually report a chronic illness, and depression rates are significantly higher with these group of people. They navigate more than just their symptoms, and they'll need tools that support their peace of mind and confidence.
So in a chronic care setting, adherence is particularly challenging even under the best of circumstances. So we need to provide users with confidence and ease in order to ensure the best outcomes. And that means designing experiences that empower, not overwhelm, and build the user's trust with supportive UX. With clear feedback and confirmation, we can reassure them and we can keep the experience flexible with multiple paths or modalities for our content. And we can use clear, simple language and a streamlined flow to avoid distractions. So a successful experience will be easy for the user to complete their task, of course, but it's also going to give them confidence that they've done so correctly. And this is the same framework that we often apply in usability testing, but it's even more critical for aging chronic condition patients because they need that reassurance and accuracy in order to have the best healthcare outcomes. So we really wanted to get a personal perspective, and so we ended up interviewing one of our target users, and her experience actually reflected nearly all of the population data that we're seeing and that we've been sharing so far. So Sheila is a 78-year-old woman. She lives with her 83-year-old husband, and they live in a two-family home where their adult child lives on another floor with their family. So it's just like a downstairs apartment. And she calls herself the daughter of stubborn Irish immigrants and says that she rarely contacts her doctor, even if she knows that she probably should. She has 9 chronic conditions, self reported. She says that she has kidney disease, high blood pressure, blood clots, uterine cancer. She did have a hysterectomy, so it's in remission, but she still has to go to the cancer center consistently to check her status. And then she has depression, obesity, a thyroid condition, macular degeneration, and chronic migraines. So you can see, obviously, it's a lot for anyone to manage. She says she takes 10 medications every morning and 4 every evening. And she doesn't really use any reminder tools. She just keeps them all in her head. She did say that she loves her PCP and her gynecologist, who are both women. And because she has these close relationships with them, she prefers to call their offices directly rather than use a tool like MyChart to send chats or something like that. And she said, I prefer to speak with a human being and not text so that my cell phone is not attached to my body. I want to just say that this was expressed with disdain for people, I think, who are constantly on their phones. So she didn't want to be like that. And in addition to her own care, Sheila is also responsible for her husband's health care. And he has depression, high blood pressure, arthritis, collapsed vertebra, and possibly early phase dementia. So most days she cooks him breakfast. Apparently, he will only accept scrambled eggs. She helps him with hygiene, takes him to any appointments, and handles all of the grocery shopping. And because her husband is starting to struggle to understand and remember things, Sheila has to be the one to answer questions with his doctors. But they've recently gotten some services from the VA, like in home nursing care and a chairlift for the stairs. And she finds these really, really helpful. It's taken some of the burden off of her. Still, though, she says she really wishes they didn't need so much help from their family. Remember, they have family that lives in an apartment next to them or with them. And she doesn't like to feel like she's a burden to them. So she would like if they needed less help. So, how does Sheila use technology? Well, with her macular degeneration, she's aware that she may need to use accessibility tools at some point, but she's really resistant to that until she feels like she absolutely has to. And even so, we noticed that the font on her phone is pretty large. She can really only fit about 2 short text messages on the screen at a time. As we said, she typically prefers to call her doctors rather than use a digital experience, but there is an exception for medication renewals because she says she doesn't want to feel needy or like an imposition for needing something so simple. So she doesn't want to call for something she feels like I can just do that easily on my own. She claims that most digital interfaces are easier for her to use on her laptop than on her phone because of the small screen and her preference for large text. She also has a blood pressure cuff at home, but she doesn't really use it because she says it throws a lot of errors and then she spends all her time trying to figure out what's wrong. So she says it's a nuisance. And when we asked her what would be most helpful to her health, she actually said that a housekeeper would be better than any digital tool because they would give her peace of mind.
So, chronic care isn't linear. It's a continuous cycle that spans from pre diagnosis through treatment, remission, and any potential flare ups. Patients move back and forth across this timeline, often needing support at every single stage. Designing this journey means accounting for changing needs over time. In the pre diagnosis stage, patients need reassurance. They also need validation and guidance on what to do next. At the diagnosis stage, it's all about delivering information clearly and calmly without overwhelming them. Helping patients understand their next steps and the available resources builds confidence and trust. During acute treatment, it's really important to reduce a cognitive load, and to focus on just one important task at a time, especially right after the diagnosis and flare up. In disease management phase, patients will benefit from sustainable and flexible support like having scheduled reminders, customization options, and community connections. Both stages require different UX approaches that are tailored to the patient's mindset and capacity. In the remission phase, patients benefit from low pressure support, and they may even engage in helping others with similar or the same comorbidities. Right, this is a great time for empowerment. During the flare-up stages, the focus often shifts to reducing anxiety, simplifying tasks, and ensuring easy access to care. Both stages require UX that flexes with the patient's emotional and physical state.
And so, an important consideration when we're designing for older adults with chronic conditions is the caregiver experience. For all of the same reasons that make accessing care challenging for these users, they're more likely to receive assistance from a caregiver or family member. So, we have to approach our designs with the assumption that the patient may not be the user. That means considering use cases like proxy access or the need to securely manage multiple accounts simultaneously. And it also means taking into account the additional emotional burden on the caregiver. Managing someone else's care creates tremendous stress and pressure, creating effects like a higher rate of depression among caregivers than in the general population. It's double, so quite high. Also means considering the difference between attitudinal and behavioral data, or what users say versus what they do. The NIH has found that chronic illness actually amplifies the gap between intention and behavior, saying that the power of habit is greater than the power of intention, even when a person's health is at stake. And so, for example, Sheila's husband is often asking his family to bring him beer and fried food, even though this is not recommended by his doctors. And he's not honest about his compliance with his care plan. So, definitely creates additional stress for Sheila. We also understand that support services can be hugely helpful to caregivers. For example, remember that Sheila said that a housekeeper would be more helpful to her than any application. So that means that we might integrate with other systems. Maybe we surface services that the user might not be aware of and treat every person who's taking an action that supports the patient and caregiver's well being as a member of their care team. It's critical for older users to maintain their autonomy and independence. So we should try to support their agency by allowing them to set their own engagement levels. This might mean configuring the cadence and modality of notifications, integrating with tools that they already use. Also means supporting power users with more robust controls. So while the default setting might be simplified and streamlined to avoid overwhelm, we can offer settings for greater control as well, except in the case where an override is needed during an escalation of symptoms. Just to clarify, we do have some very tech savvy older users. And so what we're saying is they need to have the ability to use these tools in the way that works best for them. And as we've seen, older patients are often dealing with multiple conditions at once. Remember that Sheila had 9 different conditions. So we need to design experiences that anticipate comorbidities. That means using consistent interaction patterns throughout, even for different conditions. Also means potentially sharing relevant tracking inputs that might have risk implications for other conditions. So, like if someone reports a change in blood pressure, then that might have implications for another one of their conditions. And lastly, since we know that depression often accompanies other chronic conditions, we should be ready to support the user's mental health, even if they haven't specifically reported that as an issue.
So this next section that we're going to dive into focuses on practical strategies for making research and design more accessible and inclusive, because quality care needs to work for everyone. When doing research with people who have chronic conditions, it's really important to approach conversations with respect and empathy. That starts with learning about conditions and how patients talk about them. For example, using the term ME, which stands for myalgic encephalomyelitis, instead of the term chronic fatigue. Also using first person language, such as person with diabetes rather than diabetic, and being mindful of how you recruit participants to avoid bias. These small but intentional practices will help you build trust and improve the quality of your insights. The idea echoed in Tad Hirsch's paper, Practicing Without a License, Design Research as Psychotherapy, frames design research as a form of care. So I highly recommend looking into that. Protecting protecting participant privacy is really important, especially when working with sensitive health topics. Letting participants know that they can skip any questions they're uncomfortable with and that their feedback will be anonymized. Also, taking extra steps to safeguard their data, like securely deleting files with sensitive information. And when applicable, make sure to keep HIPAA guidelines in mind at all times during your research. So older adults are using technology now more than ever, right? Over 75% of people over 60 use smartphones, and more than half own a tablet. Many seniors text daily, showing strong digital engagement. But at the same time, 73% of those over the age of 65 say that they need help with their new devices, reminding us that accessibility and guidance still matter. And this chart here shows the vast majority of users, over 70% of them prefer larger standard text sizes that's available within apps. And it really reflects the need for scalable and readable interfaces. It's also a great moment to acknowledge the common antidote that older adults often keep their text messages super magnified, and designing with flexible text options that have text magnification and scalable layouts supports both usability and dignity for these patients.
Yeah. Just a quick note there. So when we say that anecdote, just I'm sure everyone here is familiar with, looking to the side in a public place and noticing that the older person next to you has absolutely massive text on their phone. So that is supported by the data. All right. So Sheila's saying that she prefers to call her doctor and only wants to use digital experience to request prescription refills is actually pretty consistent with what we see at population scale. There is a preference for phone only or voice first interfaces. And then also many older adults also have voice assistants like Alexa at home. Sometimes they actually have voice activated safety systems. So like there's those systems to detect if someone has a fall and then they'll talk to them. And even people who try to use telehealth often end up having a phone visit rather than through a digital interface. So it really behooves us to explore voice interfaces for these users. Also, when we're looking to reach underserved populations, a group that often goes overlooked is rural residents. Older adults represent a greater share of the population in rural areas than in non-rural areas. So that means we need to consider the unique needs and challenges of this subgroup when we're designing for everyone. The most significant implication of this rural population of users is the likelihood of slower internet speeds. In rural communities, users may have slower speeds or even live in a so-called dead zone without cell service. So this means we need to design experiences that can load and perform at lower bandwidths and to offer alternatives like the voice first interfaces that we talked about, or phone first, basically. So there are certain design patterns that can be particularly valuable in chronic care UX. For example, data visualization should reduce the mental labor that the user has to do by interpreting the data for them and displaying the key takeaways rather than just displaying charts and leaving the interpretation to the user. Another thing that we can try is press and hold interactions as a form maybe of error prevention to make sure that actions are purposeful and not accidental. We can also use this pattern to encourage the user to invest in their journey or commit to a care plan. As you can see, the Flow app is doing here. In this way, it's saying, yes, I commit to this, I'm invested in this, and it makes it more likely that the user will continue to adhere to their care plan and continue to use the application. We can also add some light gamification to make the experience a little more rewarding for the user. So maybe a little celebration animation after the user completes a healthcare task that could encourage adherence, similar to the success screen at the end of a Duolingo lesson. I know that we had another speaker that showed something like this yesterday, so definitely a great idea. And lastly, we need to consider style and tone in our experiences. Again, reassurance is key. So we can use an empathetic voice in our content. We can also choose visuals that emphasize calming and humanity, maybe choosing illustrations instead of stock photos, avoiding really clinical imagery, choosing soft, warm graphics. And similarly, we want to avoid too much medical jargon and instead use action language that empowers the user. So, who's doing this well? Well, a few brands that we might look to include Medisafe, Flow, Clara, and the Atlantic Health System. So for Medisafe, some of the things that they're doing well include, as a patient engagement platform that includes adherence features, they have configurable notifications, they connect to support services, and they celebrate milestones. For Flow, they have slow, deliberate UX that provides simple and clear context to motivate every action. And we already saw that press and hold interaction to help the user become invested. I do want to briefly note, if you haven't looked at the Flow onboarding experience, check it out. It's something like 90 screens, which sounds really counterintuitive to us as friction-averse UXers, but it's so well done in terms of how it sort of slowly invests the user in the value of the tool. So definitely check it out. So then Clara is a patient communication platform that has really excellent pre and post visit messaging to ensure continuity of care. It's short, it's clear, it's informative. It makes sure that users are prepared to attend their visit and then adhere to their care plan afterward. And then Atlantic Health, what they're doing really well is, to a great extent, it's the aesthetic. They've really leaned into a human aesthetic. They're using soft and inviting illustrations instead of very clinical stock photography. They also have multiple paths to find content or take action. So instead of there being just one way to reach some content, they've actually got action buttons. They've got multiple paths in their navigation. They make sure that people can take the action that is most intuitive to them and the path that is intuitive to them to find the right content. They also don't hide phone numbers. They understand that people want to call sometimes, and they allow them to do that.
So, thoughtful design in chronic care has a real world impact, right? It can ease the burden on the caregivers while also boosting the patient's confidence and thus improving their adherence to their care plans. This includes everything from post-discharge instructions all the way to home care support. Ultimately, you'll find that smarter engagement helps reduce healthcare costs across the entire system. So to wrap up, aging patients with chronic conditions need research, design, and accessibility strategies that are tailored specifically to them. It's also important to think about the role and needs of caregivers, who are super important to the care experience. Thoughtful UX isn't just about usability, it's about reaching target outcomes. We all know it has the power to impact health outcomes, and when we design with intention and empathy, we create care experiences that work for everyone. So, thank you so much for your time and attention today. We hope this gave you a deeper understanding of how thoughtful UX can support aging patients with chronic conditions. If you'd like to connect or continue the conversation, you can find Missy and I both on LinkedIn. And now we'd love to take any questions that you may have.
Awesome. Thanks
Thank you so
all.
much, Missy. And
Let's check out the poll. I'd like to see. Okay, well, we didn't get a whole lot of people voting. So if you haven't voted yet, pop into the poll on the right side of your screen and please vote. We'd love to get a larger sample size here. But yeah, we definitely wanted to bring up the caregiver experience more. I also know that it came up yesterday in some of the other sessions. And so definitely something that gets overlooked often and that we want to start to give more attention to, particularly for this population.
yeah, let's give it a couple of minutes. I see there's more votes coming in now, so that's great. Thank you so much. I don't know how large the sample size is going to be, but keep voting.
Yeah, that's fine. All right. Any questions or thoughts? I'm particularly, curious if you've seen any other really good examples, maybe of this kind of approach. Voice first interfaces, focus on rural users. Really creative accessibility approaches, this kind of thing.
Yeah, I don't know if this adds any sort of full insight, but yeah, where I'm based in Cape Town, South Africa, it's actually a huge problem for sort of low resource areas, and we have a large amount of them where people just don't have access to sort of digital or any form of sort of device, and if they are using a device, it's sort of very old school, for a better word.
Mm-hmm.
I mean,
Yeah.
does this sort of apply to them, or how,
Mm-hmm.
like how can
Yeah.
we sort of include, and this is something to think about, really.
Yeah, for sure. I think it's, to a great extent, it's making sure that we're not so the reason that we focused on aging chronic condition patients is because obviously chronic condition patients, they have all of their own needs. But when you get into a population that is more likely to be rural, more likely to be disabled, more likely to require assistance, the needs start really changing from the rest of the population. So we can't necessarily design for sort of the average chronic condition patient, and instead we have to look at the people who maybe have the most barriers to care.
Yeah, I love what you said earlier on with regards to, you know, I mean, I suffer from a chronic disease, and
Mm-hmm.
eating healthy, I can, my wife's on me about that all the time.
Mm-hmm.
And so I can relate to what you said with your case study that you did, where your husband just doesn't want to listen to it, and sometimes just misleads. I do that all the time. I hate to say this to the doctors, and I do this quite often with, I mean, the big one that comes in. They're like, how many glasses of wine do you consume a week? And it
Mm-hmm.
generally ends up like one or two, which is not really the case. I see a question just popped up. Let me just
Yeah.
bring it up. I don't know if any of you can see it on that side.
Do you want to take the first one? I can read it. So the first question is, do you have advice for how to help persuade your team to consider a single yet important user or use case and not just the needs of the broader user population?
Yeah, I mean, one approach that's worked well for me is to frame the specific user or use case as like a lens of uncovering like broader usability issues, right? So often using like storytelling and data together at the same time. I like sharing like a real quote or like a clip from the user, and like also pairing it with metrics when doing this, just to like kind of like humanize the impact when talking about that group. So yeah, what about you?
Yeah, I would agree. I think that, it's kind of the way that we frame the talk overall, which is sharing population level data and then like, hey, there's this one person that actually illustrates almost all of this. So that's a good way to do it, is to kind of demonstrate that your use case actually reflects the broader trends. it can be difficult, like I said, when you're looking at, a minority. So for example, when we talk about rural populations and we say, well, there's a larger share of seniors in a rural location than in a non-rural location, that's true, but there's still a minority of the overall population, so it can be a little challenging to express that. But when you just say clearly that, if you design for this extreme, it will include everyone, because it will also work for people in non-rural populations. And now you've got everyone instead of just limiting yourself to the non-rural population. So it's that kind of creative use of both the quant and the qual to make your case. All right, so another question we got was, how can we bridge the digital gap for aging individuals with chronic conditions who may not feel comfortable with technology? What strategies can we use to build trust, confidence, and accessibility for users who often say, I'm not a tech person?
I think that's a good question, right? I think oftentimes we come across that, right? Like I have, for example, I use myself, right? My mom, anti-technology, complete anti-technology. Um, but oftentimes a lot of her healthcare requires technology, right? She has to log into portals. So for me, it's not necessary. So when I help her with this kind of stuff, it's not necessarily doing it for her. I kind of walk her through it with me, right? Giving her kind of that confidence to be able to do it on her own if the event, I'm not available. So kind of like breadcrumbing it, right? So little by little, getting them to trust the technology, and also just teaching them how to use it. Because I think sometimes what you may find is that it's not that they hate technology, it's that they think technology is too difficult, right? It's complicating the system. So showing that technology can really be a tool as opposed to kind of a nuisance tends to be helpful.
Yeah. So another question we got is, have you all come across any insights or sentiments about biometric adoption in this population? So I'm going to answer this. I have not seen data that's specific to an aging population with regards to biometric data. However, applying what we know about biometric adoption in general, and then what we know of this population, I would say probably what you're looking at is it's going to end up being less a concern of their willingness to try it, which I think is going to be on par with their willingness to try any new tech. And more, it's going to be about whether that's actually the best choice for them. You're going to run into issues because of accessibility concerns like, mobility, what's it called? Fine motor control, failing eyesight, that you can't do like an eye, scanning, if you can't see what you're looking, where you need to line up with the screen. So, or face, the face recognition, same thing. So point is that any type of biometric identification actually just becomes more difficult when you have more accessibility challenges and more disabilities. The other issue too is that there are a lot of studies that show that seniors have the least concerns about privacy of any group, but the most breaches of privacy of any group. So they're not really worried about it, but there's a lot of risk to them in terms of protecting their privacy. So I would personally be quite careful about pushing any kind of biometric authentication options for this population, both because of accessibility concerns and because of privacy. Sometimes we have to take the additional step to protect their data because they're not actually aware of the need. Cool.
Yeah, and
Thank
also
you
just
for
to
that.
add to that point, a quick thing is like, if you absolutely have to do it, I think keeping them in control of their data. So always at every single step, informing them why this is important rather than just do it, building that trust in the technology by just being super informational at every single step is helpful there.
Yeah, Brian just made an interesting comment, and I was just chuckling to myself. He says they're not tech savvy, but all of the time they engage in Facebook and Instagram all day. And he's obviously talking about his mum. And I can say the same about my 72-year-old mum who's on TikTok and tells me about the reels.
Yeah.
I'm not even on TikTok.
Yeah, my mom sends me crazy stuff on WhatsApp every day, and it's mostly stuff that she finds on Facebook. So